Welcome everybody to our weekly residence forum. Today once a week we discuss cases within the clinic that we're interested in or we're having some difficulty with, and it gives us a chance to sort of analyze a patient more in depth. So welcome to the forum, and today we have our chief resident, Kylene, who has several cases that she wants to discuss with us. Okay? So Kylene, who's up first?
Okay, so we have
Speak up.
53-year-old female. We've discussed her in the past. She has blood pressure that occurs when her fight or flight triggers. So for most of the time, she's perfectly fine, but when she triggers, her blood pressures can go in excess of 170 over 100, systolic over diastolic. Today, whenever she arrives to the acupuncture clinic, the white coat syndrome does trigger the blood pressure issue. So whenever we see her, she's always in full-blown high blood pressure. So we've consistently gone after her liver pulse, as you can see, and supported the reverse hook pulse that she has, and yet we're still not able to control the trigger and then the excessive blood pressure as a result.
This is an interesting case because this woman's pulse, her radial pulse, is, even when she was having the high blood pressure phenomenon today, when she was in the clinic, this is supposedly the white coat syndrome. Even when I felt her pulse, there was no way that this woman, I would say this woman has high blood pressure. So as soon as I felt her pulse, in my mind, I just regarded the complaint as it's not that it's not a credible complaint, because her blood pressure is elevated, but I do not consider that a health problem for this woman. Her liver pulse was agitated, and she has a reverse hook pulse, which means the chur pulse is higher than the soon pulse, meaning that the woman is plagued with a fight or flight response, a sort of an existential angst. So when I felt her pulse, the only thing I felt like doing is treating her liver and just calming it down, using heavier herbs like Zhenjimu, Shur, Longumuli, things like this. Now what was interesting, I did feel the pulse at her elbow crease, which we call the brachial pulse, and lo and behold, that pulse was pounding. I mean, very, very strong. So now this is a whole new picture with this patient. And you need to pay attention to this, that when you're feeling someone's pulse, and you become fairly good at this, you know what high blood pressure feels like. The pulse is always pounding. It can be pounding at the surface or pounding at depth or even in the middle positions. But it will be quite a bit of strength with the pulse. You can safely tell the patient you have high blood pressure. And nine and a half times out of 10 you'll be accurate. They'll say, yes, I do. But there will be people where you feel their pulse and you might tell them, well, you get anxious or you get emotional ups and down because the liver pulse is too high. And then they'll chime in, and I have high blood pressure. And you missed it because the pulse is not pounding, really. You then should immediately think about the brachial pulse. If they really have high blood pressure, and if in your office it shows, look at the chart and you'll see that the blood pressure is high, you feel that brachial pulse at the elbow crease. And in this case it was pounding. I mean, thick, strong, wide, and pounding, full-blown heat condition. And just down her arm at the wrist crease, that pulse is not available. What that means is that she definitely has some sort of vascular constriction from between her elbow and her wrist. And if she has that kind of vascular constriction, she probably has it in her kidneys, in the capillaries of her kidneys. This is called renal hypertension, and it is high blood pressure, but we have to treat it with vasodilators. We have to treat it by expanding the small capillaries of the body, especially in the kidney. Otherwise, they can really damage their kidney over time. Okay? So the herbs that we gave her today were designed to calm her liver down. But next week, we will give her a different formula, and that formula will be Shui Ding Xian, 20% Xiang Fen Sao, 20, Le Li Zhi He, 20, Dilong, 20, and Dan Shen, 20. So 20, 20, 20, 20. This will work as a vasodilator for the small vessels of her kidney and will ensure that their blood pressure will come down. It works pretty well. I've used this before, okay? So beware of that. When you feel a pulse and it's fairly, there could be a little strength behind it, but not enough to suspect high blood pressure. And if they tell you, I have high blood pressure, you look at that brachial pulse and you will see a whole different picture. If the brachial pulse is weak, then they truly have white coat syndrome, meaning they just get tense when they're in a room with doctors. And she had other fish to fry. I mean, she has other health problems other than white coat syndrome. What she has is a perpetual fight or flight response. That should be fixed. But in this case, she really does have high blood pressure. She really does. And even though she says it's normal at home, I think she's just in a very relaxed state. At the slightest provocation, her blood pressure is going to go up and it's going to affect the flow of blood through her kidneys. Okay? Thank you. Okay, we're back, and Kylene had a follow-up question for the renal hypertension.
Okay, so this patient doesn't have blood pressure, high blood pressure all the time. It's only by instant. So does she take the formula we discussed when she has the high blood pressure, or does she take this throughout the entire week?
Okay, her brachial pulse was so strong, it could drive a Mercedes. So it's very difficult for me to believe that she does not have high blood pressure at home. Maybe her cuff says she has low blood pressure or normal pressure. I don't quite believe it, quite frankly. So I would give her these type of herbs for her kidney for some time. This is a woman who has no high blood pressure medication at all. And it turns out that Western drugs in this case could work very well. A diuretic in this case will not work well, like hydrochlorothiazide. But what the patient needs really is an angiotensin II blocker like Benicar, or another name for that is losartan, or an ACE inhibitor, lisinopril. These two classes of drugs will soften the vessel wall so that when the blood pulse moves through the vessel wall, the capillary can open up. It's more limber. This will take the pressure off the small arteries of the kidney. Those would be appropriate class of drugs to give that patient. But she doesn't want to take drugs, so she's stuck with us. So we have to do the same thing. We have to soften the vessel walls and protect her kidney. And I actually taught her how to feel her brachial pulse. And I asked her when she goes home and she measures her blood pressure, and if the blood pressure comes out normal, which she claims it is at home, like 130/70, I want her to feel that brachial pulse. And if it's still pounding as it was today, then I know this woman has a problem no matter what the blood pressure cuff says. And that problem, the danger of that problem is, of course, in the kidney. If those capillaries in the kidney get harmed in any way, then she could have renal damage. So, quite frankly, she needs a drug. She needs some kind of drug, lisinopril. So if I can't get that brachial pulse to calm down over the next 3 weeks, I will insist that she takes pharmaceutical drugs. Okay? Okay, what's next?
Okay, so we have 40-year-old patient, very sensitive with needles. She's had chronic fatigue, insomnia, low back pain, migraine headache, neck shoulder tension. She's a patient who's had a very stressful life in terms of her workload. Over the last 10 years, she's a workhorse. She's very smart, very bright, and she's been diagnosed with ADD. So she takes drugs like the Vyvanse and Adderall to focus her mind, but she wants to come off of these drugs.
And her complaint, of course, is fatigue. What's interesting with these kind of ADD patients is they're almost always deficient in tyrosine, which is it's an amino acid. And that's the T and T3 and T4. These people almost always have some sort of thyroid problem. And of course ADD is, where they have attention deficit disorder, where they can't pay attention to something. and they're given a drug Adderall, which is basically speed, and which does have an effect on the on the tyrosine in their body. It doesn't create tyrosine, but it sort of circulates it better. It's better just to give them the amino acid, and very often they snap out of it. Now, from a Chinese medical point of view, it depends on the pulse, of course. And so let's just look and see what we've been giving her. She had some back issues, and we could see that she had a little kidney stone on her right ureter, I believe. And so we gave her some herbs for a kidney stone to get rid of it, and because she has some back issues. But her main issue is this chronic fatigue, and her pulses are very deep. How much does she weigh? Is she overweight?
She's not overweight. She's tall,
Okay.
and she's about average weight. She looks very lanky though.
Yeah.
Yeah.
And that was her major thing, the chronic fatigue or the anxiety?
The chronic fatigue and the anxiety is a portion of it.
Okay. And what was your diagnosis when you saw the patient? In other words, what's the matter with her from a Chinese point of view in your mind?
She had this is a kidney heart disharmony. She had from the very beginning. Let's take a look. She had the reverse pulse, but she was deficient. She was deficient in her left side. The heart was weak,
Okay.
and the adrenals were too hyperactive. The kidney was too active.
Her fatigue is 50% better, her anxiety is 80% better, insomnia is 50% better. So she's responding to treatment. We just deviated from it just for 1 week because of the kidney stone. And if I remember right, she eats a lot of spinach. So people who eat a lot of spinach will be susceptible to kidney stones. You need to know that.
So my question, she's taking she works well with the reverse pulse, the formula that we gave her. However, she's still taking the Vyvanse and the Adderall as needed for her
Okay.
job. She's under a lot of pressure.
What we'll do with this patient is we'll continue with the Zerbai Digwang Wang. She has warm hands. We'll continue with the Zerbai Digwang Wang, 20 grams, Sheng Mai Song, 40 grams, and Tian Wang Bushindan, 40 grams. That will take care of the reverse pulse. Then we will give her L-tyrosine. We will give it to her. We'll start her with 1 pill in the morning and 1 pill in the afternoon. And we'll see if that doesn't make it so that she doesn't have to take Adderall.
Okay.
That will be our protocol for this patient. It's amazing what you can do with amino acids. They don't work as well as Chinese herbal medicine done properly, which is far more holistic. But sometimes there is a brain chemistry problem, mostly because a lot of people do not eat enough protein. They don't eat enough meat. And so a lot of Americans, and I suspect Europeans, are basically protein deficient. And that leads to all kinds of trouble. Serotonin deficiencies, because serotonin is tryptophan, which is another amino acid, is a key ingredient for making serotonin in the body. And by simply giving tryptophan, the serotonin will increase in the body. The person will feel calmer, less anxious, less irritable. Anyway, that's what we're going to do with this patient, and we'll see how it works, and then we'll pick it up on the next week and see how she's doing. Okay? All right. Good. That's it for that case.